Welcome back in. It is something that affects 1 in 8 women in their lifetime. And this month, it's all about raising awareness. Mary Bailey is a nurse practitioner from the Toledo Clinic. She's here to go over what you need to know about breast cancer. And you're wearing your pink scrubs today.
Yes, I felt it was appropriate.
Yeah, very, very fitting October Breast Cancer Awareness Month, as I mentioned. So let's break it down a little bit. What exactly is breast cancer? I'm sure there's different kinds of it. And why is it so important that we take the time to raise awareness?
Breast cancer is a disease, and it basically is a malfunction of the cells within the breast tissue. They kind of go on their own. They rapidly grow out of control. Awareness is key because early detection saves lives. Catching breast cancer in the early stages can mean great response to treatment and even sometimes curability.
Yeah, and you've worked in oncology for a while. I'm sure you've really seen it all too in terms of who's impacted, you know, whether I imagine family history plays a big role in that.
Family history, men and women can also, you know, have breast cancer. So it's far more common in women, but men should, you know, be aware if they have any masses, lumps, bumps. We need to really be aware of knowing our bodies.
Yeah, that's what I was going to ask. What are some things that we can do at home to keep an eye out, if you will, for breast cancer?
So a great place to start is monthly self-breast exams. Getting to know what your body looks and feels like normally will help you identify quickly any changes. So what you want to look for is the obvious masses, lumps, bumps, but skin changes, hardening, nipple inversion, drainage, those can all be red flags. And if you do find any of those, you need to make sure you contact your healthcare provider immediately.
Right. Maybe would it be even like a rash or something that just looks different? Maybe?
Anything that's really different from what your normal is, I would get checked out. You'd rather be safe than sorry.
Right. And then at what point, though, what age do we start getting things like mammograms?
So for most women, it's going to be age of 40. Now, if you have family history or other risk factors, you know, that might dispose you might go a little earlier, and that'll be a conversation between you and your healthcare provider.
Yeah, and do you find that people really need to advocate for themselves in cases like that, or if I call my doctor and say I'm feeling a lump, I'm guessing your doctor is going to jump on that, right?
Oh yeah. A lump you should be seen in the office, have it evaluated. They'll usually start with a mammogram and an ultrasound, and then, you know, go from there if we need to do a biopsy.
Yeah, let's talk a little bit about a mammogram, because there might be some women at home who are going, oh, I really don't want to have this done, but it's so important. Talk us through a little bit. Now, I know I've had several already in my life, and I know it's not nearly as bad as you think it's going to be, but at Toledo Clinic, you've got great techs that will help walk you through and make you comfortable. Mammograms
are amazing. They can actually detect cancer before any symptoms are evident. I've actually had a mammogram, and I remember my mom, my grandma I don't want to get squeezed. And it definitely was not as bad as I thought it was going to be. I feel like there's less pressure nowadays. But it's really important to get an annual screening after the age of 40 and stay up on them, especially to get your baseline and then go year to year for that.
Yeah, and see if there's any kind of changes happening there. And as you said, this technology is really amazing right now. And the Toledo Clinic actually does walk-in mammograms too, right?
We do. Our Mommy Cancer Center radiology department has walk-in mammograms. You do not need an appointment. You do need a physician order.
Okay.
That's really important. But yeah, you can come get screened with us Monday through Friday, 8 to 4. And you can get more information and reach out to us at ToledoClinic.com/radiology.
Yeah, that is your sign here. If you're watching and you went, yeah, I've been putting that off. My doctor gave me that order at my last physical, and I just haven't made that appointment. You don't even have to make an appointment. Just make sure you bring that order with you. And as you said, it's really important to get that early detection because we see much better outcomes.
Absolutely.
Yeah, very good. So make that appointment and do those monthly checks, and it's better safe than sorry,
Always.
right? Yeah.
Go get screened.
Yeah, very good. Thanks so much for being here today.
Thank you for having me.
We appreciate it.